Good afternoon, everyone, and welcome to today's continuing legal education presentation on Minnesota commercial tobacco retail licensing requirements and public health policy options. I'm Willow Najjar Anderson, a staff attorney at Public Health Law Center. Joining me today are Rachel Chambers, also a staff attorney on our Minnesota team. Rachel was a public defender for many years in Bemidji, Park Rapids, and Minneapolis. She also served with AmeriCorps Vista in Colorado. Rachel Callanan, our lead senior staff attorney for Minnesota Technical Assistance in Commercial Tobacco, has been with the Public Health Law Center for over 6 years. And previously, she was regional vice president of advocacy for the American Heart Association and has 18 years of experience in nonprofit advocacy, including work with the Minnesota Coalition for Homeless and the Minnesota Housing Partnership. And last but not least, we have Katie Ingman. She's a program director at American Association for Non-Smokers, and she's our expert enforcer on the call today. She's been at the helm of commercial tobacco prevention for over 20 years. Katie has achieved extraordinary policy successes throughout the state of Minnesota, like smoke-free workplace policies and flavored tobacco restrictions, which have leading policies in the nation. This is the Public Health Law Center, where I work, and my colleagues Rachel Callanan and Rachel Chambers work. It's in St. Paul, Minnesota, where we acknowledge that we are in the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in this area. The region is shared territory with the Anishinaabe, also known as the Ojibwe or Chippewa. The Ho-Chunk Nation also has a historic relationship in this region. We appreciate the ongoing stewardship, spiritual connections, and lifeways developed in these homelands upon which this law school sits. This land acknowledgement on the slide was developed by the Native American Law and Sovereignty Institute at Mitchell-Hamlin School of Law and is being used here with permission. For more information on the indigenous peoples in these tribal lands, we encourage you to visit the URL on this slide. Relatedly, we want to acknowledge the difference between traditional and commercial tobacco. Throughout this presentation, we will refer to the impacts of tobacco, but we want to clarify that we're specifically talking about industrial scale commercial tobacco production, and we're not talking about traditional tobacco as it is still used religiously, medicinally, and ceremoniously in many different cultures. And here are 2 resources linked on this page for more information. At the Public Health Law Center, we offer free legal technical assistance to communities, public health advocates, and other partners. We also publish on important public health topics, and we offer trainings and webinars. And although many of us are lawyers, we don't offer direct representation, nor do we lobby. Health equity is at the center of all of our work, meaning that when we're helping to create various types of policies, we strive to be mindful of several factors that influence public health. We never want to offer policy solutions that, for example, would cause someone to lose their housing or their employment, which then, of course, adversely impacts health. For our agenda, first we have Rachel Chambers, who will provide an overview of tobacco retail licensing in Minnesota. And we will also go over a retail notice, education and training, and legal requirements in relation to enforcement. And then Rachel Callanan will go over our model tobacco retail license policy. And finally, Katie Ingman and Rachel Callanan will do some question and answer about best practices. As you think of questions, please put them in the chat and we will try to address those. And in particular, we want to know, what are your barriers to enforcement? So you can be thinking about that in the background during the presentation, and then let's talk about it. With that said, let's go. Rachel Chambers, it's to you.
Sounds good. Thanks, Willow. Before we dive into an overview of tobacco retail licensing in Minnesota and state legal requirements related to the enforcement of tobacco retail licensing laws, I want to highlight this fantastic resource, Tracking Commercial Tobacco Laws, a Minnesota Digest, we recently updated in 2024. This resource covers a wide range of commercial tobacco regulations, including federal and state laws regarding sales and distribution of commercial tobacco, clean air and other use restrictions, taxation and pricing, tobacco settlement requirements, and much more. While our focus today is on enforcement of tobacco retail licensing laws as well as best practices of enforcement, it is important to set the table, so to speak, before we jump into the main course. Many tobacco retail licensing laws are located in Minnesota Statute Chapter 461. I'll cover some of the core requirements as well as recent reforms to Minnesota tobacco retail licensing laws as they relate to enforcement. First, Minnesota state law requires local jurisdictions to license and regulate the retail sale of commercial tobacco products. Counties must, and I'll say that again, must license and regulate the sale of commercial tobacco, tobacco-related devices, electronic delivery devices, and nicotine and lobelia products. This requirement is pinpointed and highlighted on the slide as the red underlined portion closest to the bottom of that slide. You can see the shall is highlighted in yellow. The other underlined sentence on this slide, located towards the top, states that towns and cities may license and regulate for retail sales of commercial tobacco products. If a city or town has their own tobacco retail licensing ordinance, then the county licensing and regulation does not apply. This is a unique feature of Minnesota law and has been the keystone to the significant local regulation of commercial tobacco products since it was required in 1997. Now, the reason we're highlighting this law again, which was covered in our first webinar, is that the county is required not only to license, it's that the county is required to enforce the law. So they are required to license and regulate. And regulate means to ensure that the laws are being followed and enforcing the law to ensure that the law is followed. So Minnesota state law explicitly allows local jurisdictions to enact laws that are more stringent than state law. Minnesota state law provides that this broad local authority for more restrictive local ordinances regulating the sale of commercial tobacco products. As a result, many local jurisdictions have enacted strong local tobacco retail licensing ordinances that achieve more protective public health policies, like prohibiting flavored products and other public health policies. This means that jurisdictions can create laws such as capping, banning flavors, assigning multiple compliance checks for retailers in violation of sales to underage persons, creating processes to better ensure compliance for enforcement, as well as mandatory or permanent revocation of a retailer license if retailers continue to violate the ordinance. Let's review Minnesota laws that are most closely related to enforcement of tobacco retail licensing laws. The first being administrative penalties for retailers that violate compliance checks or any other state legal requirement. State law requires that local jurisdictions enact a minimum administrative penalty to be enforced against the licensees for violations of tobacco retail licensing laws. For a first violation, licensees are to be assessed a minimum civil administrative fine of $300. For a second violation within 36 months, licensees are assessed a minimum civil administrative fine of $600. Then, for a third or any subsequent violation, licensees are assessed a minimum civil administrative fine of $1,000 plus a minimum 7-day suspension, and the law also specifically allows for revocation. Finally, there's also a $50 penalty for clerks and other individuals who sell or furnish licensed products to underage persons. This is now optional, it's not mandatory. The reasoning for this change, which occurred back in 2020, is that for low-wage clerks that are most likely to lose their jobs for violations, a $50 penalty may be too steep. So the law allows for discretion as to whether or not to assess this fine. The following laws highlighted on this slide also orient towards enforcement. So Minnesota Statute 461-12, Subdivision 2A, was enacted as part of the cannabis legislation law last year. It requires mandatory tobacco license suspension of 7 days and possible revocation for the impermissible sale of certain cannabis, hemp, THC products or certain violations under Chapter 342. Under Minnesota Statute 461-12, Subdivision 3, individuals found selling or furnishing licensed products to underage persons may be charged an administrative penalty of that $50. They have to have received notice and they have to have an opportunity for due process that is written in the statute. Minnesota law also addresses if underage persons use a false ID to attempt to purchase licensed products. The statute requires that law enforcement and court system representatives shall consult, as applicable, with interested persons, including but not limited to parents, guardians, educators, and persons under the age of 21, to develop alternative civil penalties for persons under the age of 21 who violate this section. Consulting participants shall consider a variety of alternative civil penalties, including but not limited to tobacco-free education programs, community service, court diversion programs, and tobacco cessation programs. And for persons under the age of 18, notice to schools and to parents or guardians. Alternative civil penalties developed under this subdivision may not and shall not include fines or monetary penalties. The point of this is to really rehabilitate underage persons with addiction. So Minnesota law also requires that no licensed product be sold to any person under the age of 21. In order to ensure this does not happen, jurisdictions are required to ensure that minimum legal sales age is enforced by conducting compliance checks. A compliance check means that a jurisdiction conducts an undercover buy or youth decoy purchase of licensed products to see whether or not a retailer will make the sale or refuse to sell. So Minnesota jurisdictions with a tobacco retail licensing ordinance, and if we recall earlier, counties must have one, cities may have one. They need to conduct a compliance checks with all retailers within their jurisdiction once per year. This is legally required, and I'll repeat that again. This is legally required, a compliance check once per year for all retailers in your jurisdiction. Now, with minimum legal sales age being changed to age 21, compliance protocols have also changed. Where the previous law required the use of persons between 15 and 17 to test for underage sales compliance, new law requires the use of persons at least 17 years of age, but under the age of 21. So we're going to go into the enforcement of federal tobacco regulations and then work our way back to state and then local. Starting with SINAR and MLSA compliance. So back in July of 1992, Congress enacted the Alcohol, Drug Abuse, and Mental Health Administration Reorganization Act. It focused on decreasing youth access to commercial tobacco. The sponsor of this amendment was Congressman Mike Sinar. This is why we call it Sinar to this day. The amendment required all states and U.S. territories to enact and enforce laws prohibiting the sale and distribution of tobacco products to individuals under the age of 18, and imposed a requirement that in order for a state or territory to receive any substance use prevention treatment and recovery services block grant awards, they had to comply with the Sinar Amendment. This is huge. The minimum legal sales age law also obviously passed and then amended that legal age from 18 to 21. So what's required under Sinar? States and U.S. territories have to enforce underage access laws to a degree that can reasonably be expected to reduce the illegal sale of persons underage. They have to conduct annual unannounced inspections that provide a valid probability sample of tobacco sale outlets accessible to minors. They have to report their sampling methodology and results of the annual SINAR survey as a part of the annual SINAR report no later than December 31st. This includes the state sampling methodology, SINAR survey results, SINAR inspection report, and then the SINAR inspection protocol. Lastly, they need to revise their methodology, inspection reports, inspection protocols to include revised age requirements under 21. And in addition, SINAR survey results must now include results for sales to youth and young adults under the age of 21. And then now lastly, they have to achieve a non-compliance rate of no more than 20%. SAMHSA requires that each state reduce its retailer violation to 20%. For more information, please click on the link at the bottom of the slide. So how does SINAR work? In the state of Minnesota, the Department of Human Services received the contract from SAMHSA to do SINAR inspections. DHS, or the Department of Human Services, conducts unannounced inspections by selecting a percentage of retailers to conduct these inspections, about a 30% sample. SINAR contractors will utilize a youth decoy, someone under the age of 21, to go and make a purchase of a tobacco product. The results are recorded. The store does not receive a penalty for this, as the purpose of SINAR is for data collection. Let's talk about FDA inspections now. So the Minnesota Department of Human Services received the FDA inspection contract in Minnesota since they were already contracted to carry out SAMHSA's SINAR inspections. State inspectors are utilized to conduct the FDA inspections. There are 7 members on the team. 5 of those team members are dedicated to engaging in tobacco retailer inspection 100% of their day. The FDA conducts inspections of almost every retailer in the state in a time frame of 1.5 to 2 years. In order for them to inspect every retailer, they would have to allocate way more funds, and they would need way more funding to do this. So looking at the numbers, though, all retailers inspected in Minnesota between a 1.5 to 2 year period. As an efficacy measure, if a retailer does not have a violation, they're probably not going to be inspected every single year. The focus will be redirected to the violating retailers. The purpose of the FDA inspection is enforcement. It's a huge difference between the FDA inspection and SINAR. FDA inspections are done for the purpose of enforcement. It is not just for information gathering, which is SINAR's focus. There are 2 types of FDA inspections. First type is a UB, or an undercover buy inspection. Contractor sends in an underage person to the store. They try to get a buy, and if they do, they take the information, which is sent back to the FDA. At that point, the state level people are hands off. They won't know what penalty, if any, the store receives. The state gets this information only when it becomes publicly available. The second type of inspection is an AL, or an advertising and labeling inspection. In this instance, the people sent into the store may be DHS staff or could be the sheriff's department, and the inspection is focusing on vending machines. Do commercial tobacco products have the warning label on them? Are they in the correct packaging? You may ask what type of inspection occurs more. That would be the undercover buy. Couple things to note: contractors are allowed to combine the FDA SINAR processes. The agency has both contracts. They can do both at the same time. However, they have to figure out how to bill their time appropriately. They can't use FDA money for SINAR enforcement and vice versa, where one violation can go towards both things. You can get a list of contractors in each state, and the FDA has every single inspection in their database. Which brings me to the database. So they keep a searchable database to the public to the list of the inspections being completed. If you are interested to see your jurisdiction, simply write the city and the state in the boxes and then click search. You don't have to narrow it down to the retailer, and then it'll show you all inspections in your area. So I entered Bemidji because I used to live and work there. And interestingly enough, of the 9 inspections you see on the screen, dating back to May of last year, 3 warning letters have been issued and 1 civil monetary penalty assessed. This next is Winona. You can see since December of last year, there has been 5 failed inspections that have resulted in 3 civil monetary penalties and 2 warning letters. This screenshot reflects Minneapolis inspections from January 25th of this year through February 6th of this year. Of the 10 inspections you've seen on the screen, there have been 6 warning letters and 1 civil monetary penalty issued. So you are seeing a lot of these warning letters being issued, but again, in order to ensure that it does not continue to happen, compliance checks need to be completed to make sure retailers are following through with their warning letters. So then there's also the Minnesota Tobacco Tax Enforcement. I'm not going to spend as much time on this slide, but just know that the Department of Revenue is also monitoring compliance with state cigarette and tobacco tax laws to ensure that businesses follow the law and are not penalized due to unfair advantage non-compliant businesses could gain by not following the law. Their role is to educate on tax obligations, to do audits, investigations of retailers and suppliers, assess civil penalties against non-compliant persons, seizing the contraband while they're at it, and then also criminal prosecution of persons evading cigarette and tobacco taxes. So when they go in and do their inspection, they do an inventory review. They also check to see if they have the license, the retailer does, and then they do an invoice review. They look to see all the invoices that are kept at the store. And then also, too, retailers, just as a note, they have to buy from a licensed distributor. All right, I'm going to start at the top of this slide, and hopefully my internet remains stable for the rest of this presentation. So proper enforcement really starts with education. An education-first model ensures that retailers are supported into achieving compliance with the law. Education should involve an overview of state and federal legal requirements, provide accessible education in the language of the retailer, and engage with education-based compliance checks, such as Congratulate and Educate, which I will review shortly, as well as endeavoring to build relationships with the retailer so that they feel comfortable in reaching out to ask questions. Let's review some of those programs. First this is our WATCH. It's an FDA Center for Tobacco Products educational program launched November of 2017. Focus is to ensure that retailers have a better understanding of FDA tobacco regulations. Why is compliance crucial? And then also ensuring underage persons are not sold to. This is voluntary. The program has a full toolkit of resources, posters, stickers in both Spanish and English, flyers, and then also compliance-based webinars, such as what a brick and mortar tobacco retailer should do after receiving a warning letter, or the 5 W's of advertising and labeling compliance. There's also the Congratulate and Educate program, created about 10 years ago, was created to supplement inspections with SINAR. SINAR, as we just covered, only conducts a small number of inspections for the purpose of data collection. So there was a partnering with Answer to offer the Congratulate and Educate program for the purposes of education to engage in broader inspections, and doing so with the purpose of one-on-one education for retailers and clerks. The goal is education and bringing retailers and clerks into awareness regarding their role in ensuring that underage persons don't gain access to commercial tobacco. The link on the screen brings you to a document to give you a brief overview of the program of local licensing agencies such as public health and law enforcement departments. And they can actually apply for a Congratulate and Educate contract, which is reimbursed to the department for $50 per educational compliance check. And the educational materials are provided by MDH and Answer. Lastly, the enforcement best practice education first model stop sales to minors, which is offered by the Association for Non-Smokers of Minnesota, otherwise known as ANSWER. They created this free training back in 2016 with the support of the Public Health Law Center and the Minnesota Department of Health. The training was created to help support tobacco retailers in their compliance with state and federal law. While local jurisdictions can have more stringent laws, the stop sales to minors training focuses on state and federal law. The training was updated in 2020 to conform with Tobacco 21. So what's the training format? It's 3 sections, an hour long. The first segment focuses on tobacco and health and state and federal tobacco laws. 21-minute video, 10-question quiz. Second segment focuses on compliance checks and penalties, consists of an 8-minute video followed by a 5-question quiz. The last segment pertains to avoiding illegal sales. It consists of a 17-minute video followed by a 10-question quiz. A retailer must answer at least 17 questions correctly in order to receive a certificate of successful completion. After the training is completed, a certificate is mailed to the email address provided at registration. There are many approaches that local jurisdictions can take to ensure that retailers are aware of the law and penalties for violating the law regarding the sale of licensed products. Jurisdictions can require that a retailer go through the stop sales to minors training if there's a violation within a specific time frame. Jurisdictions can require that this training is undergone annually. They can also ensure that before they even get a license, they have to undergo this training. Benton County is an example of a jurisdiction that requires the latter, which is, again, you have to make sure that your employee and you have to submit an employee training roster with proof of certificate completion for the retailer and all their employees. Rachel Callanan will be highlighting that later regarding best practices from Minnesota jurisdictions. With that overview of the state law, I'm going to hand it back to Rachel Callanan to talk through how the Public Health Law Center's model tobacco retail ordinances cover enforcement of tobacco retail licensing laws, as well as best enforcement practices of tobacco retail licensing laws.
Great. Thank you, Rachel. Katie and I are going to talk about the enforcement best practices. And I first want to just sort of lay a framework that we've created. First is we're going to talk about some pre-enactment or pre-amendment of an ordinance stage of the process and some of the enforcement best practices that fall under that stage of the process. The second will be enforcement related provisions included in the actual ordinance. So we'll talk about some of those and highlight some from the Public Health Law Center's model ordinance. And then third, we'll talk about the post enactment. So after you've already adopted your ordinance or made amendments to your ordinance, what are some of the enforcement best practices there, and also the ongoing support for retailers. So starting with pre-enactment or before an ordinance is actually amended, this is really the planning and preparing stage of the process. So first things first, important steps for effective enforcement starts even before you enact or amend your ordinance. So key steps here include identifying the retailers in the jurisdiction. And this could be done by working with your cities and counties to see what businesses are licensed in your jurisdiction. If another jurisdiction has been doing the licensing, check with them to see if they have been licensed. There are several ways of doing that, but your best bet is to contact your city or county administrator to get that information. Next, before making any changes or adopting a new ordinance, local jurisdictions must follow the state notice requirement. It's 30 days for any substantial change to the tobacco licensing ordinance, and that notice needs to be given to the retailers. And then finally, conducting outreach and education of retailers about the laws governing retail tobacco licensing. So, Katie, what do you see as some of the key best practices in this stage of the process?
In this stage of the process, thank you, Rachel. I really think it's about communicating early and often, knowing who these folks are. They should know who you are. You should know who they are, so they can ask questions and really start this and build upon our relationship and conversations of making sure that we're all in the same loop together.
Great, thanks, Katie. So the next stage, still looking in the pre-enactment or ordinance amendment phase, looking at the planning for enforcement. So Katie, what enforcement best practices do you see local jurisdictions considering at this stage of the process, this planning?
I think, one of the first steps is just, like you just said, is who is required to do this. It's moved a lot in the last 10 years. We know law enforcement is really short-staffed. Public health was short-staffed for a while, but who is in charge of this and who's going to enforce this for all aspects of the ordinance, not just the sales to minors piece of it, and who's going to own it? What department's going to own it? That is how we can build relationships. It's communicated early and often. It flows down. If there's change of staff, it doesn't really matter because it's going to land on the new person's plate or somebody else's. So people want to know who's in charge or who's leading this. I also think, what are the protocols? What does our local ordinance look like? Do we have anything additional above and beyond state law? And we need to look through those pieces. So looking at it early and often, laying of what do we have, what do we want, or what do we need, I think is key.
Great, thanks, Katie. And one final point I'll make on this slide is about license fees. So a practical approach to enforcement really ensures that local jurisdictions set appropriate fees to cover all costs of administering a license. So we know enforcement takes time, it costs money, and fees provide the revenue for the administration enforcement. So these fees can also cover costs of retailer and community education. So jurisdictions really should be doing a periodic review and adjustment of their licensing fees to ensure that those fees are sufficient to cover all of the administrative costs, including the actual costs of compliance checks. So you might be asking, well, how do we know that? How do we do that? Well, Public Health Law Center has developed several tools to assist local jurisdictions calculate the true costs of tobacco retail licensing. So two of our tools are online. We have an online tobacco retail licensing calculator, and then we have a publication that I've linked here too about broader discussion about retail license fees. So included in the cost and the calculation will be the cost of administering the applications and renewals, retailer education, costs associated with the actual compliance checks, and training, including planning those inspections and costs for actually doing the compliance checks. So this is a screenshot of that online fee calculator that I mentioned. And the great news, it's also downloadable as an Excel document. So you can easily download the worksheet, do the work, and save the spreadsheet on your own computer and share it with your colleagues. So some of the fields here, are really, it's up to the local jurisdiction to decide what you want to include in there. But we wanted to create a comprehensive tool that really identifies all the potential factors that you would want to consider. So next, Katie and I are going to shift into the enforcement-related provisions included in the ordinance. So I'm going to specifically be referencing the Public Health Law Center's Model Tobacco Retail Licensing Ordinance and show how there are specific provisions in our model ordinance and how they may be structured for you in your jurisdiction. So we have a city and a county version. They're nearly identical, just some differences regarding procedural and jurisdictional issues for the different county versus city. So now we're at the stage of drafting or amending an ordinance. So here are some of the key policies to include in the actual ordinance that will really help set your jurisdiction up for successful implementation. So these are reflected in Public Health Law Center's model. First, setting license fees, already talked about that. Requiring instruction for licensees and their employees. Limiting the number of licenses. I'm going to talk about a few options for that. Specifying the department responsible for inspections. Katie mentioned that already. Requiring signage and offering free signs. Answer can help provide jurisdictions with those free signs. Requiring comprehensive compliance checks and inspections. So a specific provision around that.
establishing a due process, an appeals process for handling any violations. In the next few slides, I'll show how some of these provisions show up in our model policy. So first, looking at limiting the number of licensees in a jurisdiction, this limitation or cap on licenses can act as an enforcement mechanism. While these provisions really are primarily intended to reduce retailer density, which is important for both youth access and also reducing exposure to tobacco products for people who are trying to quit or who have quit commercial tobacco. But there is an added benefit of having fewer retailers, and that means there are fewer licensees and retail establishments to actually inspect. So it's, not a primary objective, but it definitely helps reduce the number. So there are several ways to limit the number. First, communities can just set a cap on the number of licenses that they're going to have in their jurisdiction. And I just want to note, most jurisdictions, when they set a cap, they either set it at the existing number, or if they have a reduced number, they allow for attrition. So over time, those licenses go away as businesses go out of business or licenses are revoked. I just want to note that no one, the intent here is not to pull the license from existing businesses. So other options are proximity restrictions. So you can have proximity restrictions, a distance requirement between retailers. You can have proximity restriction around youth-oriented facilities and the retailer. And then finally, you could have zoning requirements that either prohibit or limit retailers located in residential zones. I've included a link here to give you more information in depth about these different options if you want to learn more. So Public Health Law Center's model policy also contains a provision that requires multiple compliance checks. So this goes beyond the requirement in state law for a single compliance check per year. The jurisdiction can plan for 2 or even more annual compliance checks and inspections. I want to emphasize, see in paragraph B here, requires inspections are checking for compliance with all aspects of the ordinance, not just minimum legal sales age. I think often people think that's the main thing, and it's an important one. We want to be checking for minimum legal sales age, but we also need to be inspecting for the other components. So best practice would be require 2 or more annual inspections and require a follow-up inspection if there are any violations to double check for compliance. So another provision in the model ordinance is a provision that clarifies that acts of employees are considered acts of the licensee. And this provision makes the retailer accountable for any violations of the tobacco retail license ordinance. The buck stops with the retailer. This provision also points to the importance of employee training. So turning to the penalty provisions, and Rachel Chambers had a very similar looking slide that she walked through the state requirements. The fines and look back are the same in our model law with a 36-month look back period. That was enacted in 2020 and has been really important to actually hold licensees accountable. Under the previous law, there was a 24-month look back, and that time frame was just too short. So the penalties were rarely escalated to these higher fines or to suspension or revocation. So Public Health Law Center's language diverges a little bit from state law. Upon a third violation, we have a 30-day required license suspension instead of the state's 7 days. And then the license is mandatory revocation upon a 4th violation. So state law allows, it's permissive to revoke at any time, but it doesn't require a revocation. So in our version, it does. Turning to the employees of licensees, state law allows that they may be charged an administrative fine of no more than $50 for violations. Public Health Law Center's model allows for alternative language. They could be required to attend an instructional program regarding requirements of tobacco retail licensing. Answers Stop Sales to Minors program would be the perfect option for them. So this approach helps educate folks so that they're aware of the requirements. They're not just getting hit with a fine that doesn't really improve compliance with the law. So one last thing in this section, state law and public health law centers model policy do not include penalties for underage purchase, use, possession of commercial tobacco. Sometimes these are referred to as PUP penalties. The purpose of a tobacco retail licensing ordinance is to regulate the retail sales of commercial tobacco products. As we've discussed, a cornerstone to effective regulation is holding the retailer accountable. Underage purchase, use, possession has no place in a tobacco retail licensing ordinance. And in 2020, the legislature recognized this. They removed underage PUP penalties, and the Public Health Law Center model language reflects this, and it really is a best practice to focus enforcement on the action of the retailers, not the purchaser. So now Katie and I are going to shift into the post-enactment and the ongoing support for retailers. So let's start with retailer education. Katie, we know that most retailers want to comply with the law, but sometimes there's confusion about what the law requires. So what are some of the key strategies you see to help these retailers comply with the law?
Thanks, Rachel. First, let me just reiterate that I have the privilege of working with the cities, retailers, enforcement agencies, and young people to make sure that we're enforcing the law in Ramsey County. I've also had the privilege of working with people also in greater Minnesota. So I think the number one thing that we need to talk about here is making sure that communication is happening early and often and that everyone is on the same page. Most retailers want to comply with the laws, but sometimes there's confusion about, is this required? What's required? Communication with retailers early and often is so important. We want them to come to city staff or us or somebody and say, can I sell this product? Am I doing this right? Truthfully, wholesalers really don't care. They don't take the time to learn the local nuances of each local ordinance, and their goal is to get products on the shelves and money coming in. So I'm just going to scroll through a big shout out to my friends in Benton County who did awesome work. But this is an example of a proactive mailing that the public health department sent out to all retailers before their ordinance went into effect. As you can see, these reminder mailings, visits such as Congratulate, Educate, any other notifications of changes like we mentioned earlier, the 30-day notice is so important to keep everybody on the same page. Next slide. I just want to give a shout out again to Benton County. We did something very similar to this, like I'll share later in St. Paul, but they updated their ordinance in multiple areas around the sales of flavored products, the price of products, and coupon redemption. So there was a lot of really great things packed into their local ordinance that went above and beyond state law. To break down their ordinance for their retailers, they created this guide, as you can see, simple text, colors, photos, and also just a few general reminders. The most important thing, I think, and I think it got cut off on the bottom, but is who to contact if I have questions. You know, there is a person behind this and we want them to succeed.
Great. Thanks, Katie. And sticking with our theme of retailer education, what do you identify as some of the other things communities can do to make sure retailers get these educational resources and the information they need?
Yeah, again, we want them to comply. We need them to understand and make that information as easily accessible as possible. Think simplified. We have lots of attorneys on this. We love all of your attorney work, but we also need to bring it down right to the street level of what does this mean for me? Some other places or ideas were Benton County also did a landing page. So everything they need to know, or their commercial retailers, tobacco retailers needed to know, was all on one page. Think of links to the ordinance, overview of what's required. Think, who do I contact again to ask questions? We can break it down as much as we want, but again, we want them to succeed. We want them to comply, and most want to as well.
Yeah, and shifting to the next sort of idea is looking at the application and renewal process. And ideally, jurisdictions have done some planning for this process, and hopefully they've adopted robust licensing and renewal practices that really reinforce these enforcement best practices. So, Katie, what do you identify as or see in some of the application and renewal processes that you're seeing in communities?
The time of application and renewal is a great time to remind the retailers that you need or you're going to require them to be responsible with these sales and take sales of commercial tobacco products seriously. These are cost our communities and society thousands of dollars. So many times when a new hire is brought on board, they're overwhelmed with paperwork. They're told, sign here, date this, fill out this form, and it's a little bit overwhelming. And then, by the way, just don't sell to minors. That's it. We really encourage retailers to take the time to properly train all employees to be successful. The Stop Sales to Minors training is a great program where you can access it any time of day or night. I also will note that we can look up if a retailer has taken this. So if you have questions, if there's retailers in your community who have taken it, let me know. But again, we want them to succeed. Many times it just comes down to trusting if you have a system in place. Many people say, oh, we have a scanner, we're never going to sell. Well, I've had them override that. Or, we don't know, we're going to ask for everybody's ID, but many clerks have no idea that if you're under 21, it's vertical, not horizontal. So again, making sure that they have all these simple things and they know to trust the systems that are put in place to make sure that they're successful to refuse these sales.
Yeah, thanks, Katie. And I think you're going to talk a little bit in a minute about Benton County and how they use an attestation form or, commitment that they're going to follow the law. And they also have a roster of employee training that they attach, that their applicants are required to attach. So talk about that in a moment. So shifting over to compliance checks, really often the biggest focus in enforcement is minimum legal sales age compliance checks, which are really incredibly important. And sometimes the inspections for the other elements or provisions in an ordinance are kind of take a back seat. So I've asked Katie to talk about some of the best practices for both types of these compliance checks. And let's start with minimum legal sales age. What are some of the best practices here?
Right. So let's first determine whose department is going to do these and be responsible. Like I said, it shifted in a number of years. And let's make sure that's clear. You're going to own that. This is the department's project, and we're going to go from there. Then we also need to make sure that we have an updated list of licensed retailers. To be honest, this changes regularly. I have in one of my cities, I have a list of retailers, and they say, well, they don't sell tobacco, but they still hold that license, and so we still do need to check them. So make sure that you have an updated list of all licensed retailers that you know where you're going and who has the ability to sell these products. Remember that these are unannounced checks and that we want a fair test of the system. Do not park. So once we're out there, don't park in the front of the door, park across the street, use an unmarked car if possible. Then let's talk about young people. We need to recruit young people between the ages of 17 to 20 to help us. They're really key in this piece. I strongly suggest recruiting at least 2 students to work together. And if they can do them more than once, they have become experts, which I love because they're comfortable and it takes the nerves out and it just becomes what they do. So 2 students to work together. And I also suggest not using students directly from your community. I never want students to be in a situation where they recognize anyone in the store, recognize a friend who's maybe working there, a shopper, a friend's grandma in the parking lot, whatever. I don't want them to recognize anybody there. If they do, they should abandon the check, come back out and say, yep, I know somebody, I'm out of here, and we'll get it back. We'll get rechecked. I know and realize this is an issue, especially in greater Minnesota. It's hard to find kids, but work with your neighboring departments. It may be 45 or 50 minutes between departments, but use those kids or shift them so that you can have this ongoing piece. Um, students will need to be able to students need to be able to have cash to attempt to make the purchase. I suggest $40 with the cost of products these days. We don't want them being short and that to be an issue when attempting to purchase. So again, students go in, attempt to purchase. I usually tell them to purchase something fruity. Give them heads up if their flavored products aren't available for sale in that community. If students are asked their age, they tell the truth. If they're asked for the ID, they give it to them. If they're sold to, they take the product back out to the vehicle. If they're asked, do you want a receipt? Sure, hang out, sure, I'll grab it on the way out. So they hand everything back over to the enforcement agent, and their job is done as a student. Students should never go back in to identify that clerk. They've done their job. We don't want to put a student in that situation. If they pass, excellent. Keep moving on. There's no need to go back in and say, congratulations, you passed. Um, I send all my communities a certificate the next day. So, and they sometimes actually like to know who said no to that. So if one of my students can get the name of the ID of the clerk that said no, I get calls multiple times saying who passed and refused a sale, they get a $50 bonus. So I love that positive reinforcement. I also think of staggering times uh, and making sure that you're not going at the same time every day or when you do this. I used to have this community that we did them every time at 10 o'clock on the Thursday of MEA, and I begged to do it differently. So we can keep moving on.
Great, thanks, Katie. So the other set of inspections are really about all the other provisions that might be in the law. So flavors or coupon restrictions, things like that. So do you want to talk about some general best practices for these types of inspections?
Yeah, so I think, I'm creating a checklist of what does our local law look like? We did that pre-enactment. So what do we want to put in there? If we're going to change anything, what provisions do we have in our local law that we need to make sure that we look at? So I'm creating that checklist for that inspector, creating that relationship with the inspector to make sure that they know what they're looking for and that they know what state law is and then what local law is. Again, I go back to like change it up a little bit, make sure that everyone understands. To be honest, we all have good intentions, but if a law enforcement person, like I said, they said it's 18, right? I said, nope, it's 21. So don't make any assumptions that everyone just knows your tobacco ordinance.
Great, thanks, Katie. So finally, if there are violations, the jurisdiction should really follow through with giving licensees an appropriate hearing, notice, due process, and also follow any appeals process for appeals that may arise. And then ongoing education and relationship building, also really important component in this post enactment and ongoing support. Katie, do you want to share anything further about that ongoing relationship building?
Yeah. So again, we have early and often communications. It gives the decision-making body who is going forward, possibly going forward for an appeal, just a little bit more authority to hold down the law, hold down the violations fines, if the business continues to violate. It's really difficult if you go to church or you play golf or whatever with the business owner and to say, sorry, John, you've had multiple educational touches and reminders, you messed up, we need to impose this fine. Many times I see them go before their friends and say, okay, don't ever do it again. But again, it's our responsibility. It's our students and our community health to make sure that these retailers are responsible. So if we can build all of these educational pieces into this relationship, it's easier to enforce and hold those fines steady.
Great, thanks, Katie. So we did want to highlight a couple of Minnesota communities that are implementing some best practices. And I just want to note that there are no communities that we're aware of that are utilizing all of the best practices, but we wanted to highlight these two in Minnesota that really are doing a great job with the enforcement practices they have in place. So I asked Katie to talk about each of these communities. So I'm going to hand it over to her.
All right, St. Paul and Benton County. Next slide. So St. Paul has a really in-depth and deep ordinance with a variety of pieces that relate to the retailer, such as sign code, coupons, flavors, minimum price, sales to minors, and tobacco shop age requirements. So they really have a whole bulleted list of things that they're looking for. As you can see from this list, this is kind of their plan for the year. They're mirroring notifications, educational materials, they're renewing licenses. Everyone got an educational visit and an implementation guide, which I can show later, very similar to the one we shared with Button. They did their youth compliance checks. throughout the summer when students were available. They sent another reminder out of what are the laws you need to follow. They did another visit to check on other pieces of their ordinance where young people were not required. And again, they wanted them to pass these, and then they also respond to complaints throughout the entire year. So if you see, as a resident, you see something doesn't feel right in your community, submit a complaint. They have to respond to those. And remember that when we're doing these visits, it's their job to follow the law. These two pictures were shared with us, and they weren't, these flavored products were illegal to be sold, but they happened to be under the drawers and couch in a retailer. They took it seriously to follow up and give citations. Here's another example, just a quick example of a mailing that we did with us in partnership with the city of St. Paul when all menthol, mint, and wintergreen tobacco products were pulled out of the liquor store. So again, simple, easy to read, bright, colorful, a touch to make sure that they know what to follow or not to follow. And then also, as you note, it's pretty small, but who to contact at the city if they have questions. Another example of a mailing to retailers, which a cover letter is on the right side, breaking down the ordinance. We included free signage that is available. The sign they can hang up, we've seen it throughout the city of, hey, I can't do any coupons or discounts. Sorry, here's the sign, blame it on the city, and then a copy of the ordinance. Here's our implementation guide that was sent out right after they changed their ordinance. Again, easy to read, what's allowed, what's not allowed, who to ask questions for, who do I ask questions of? And again, we want you to succeed. Benton County does a great job when they do their license renewal. So if you can see on the far right, they have a checklist of things that need to be included in their license renewal, including have you paid your license fee? Do you have an ID on file? Do you have, has your store done training? Has everyone in your store completed the training? And making sure that everything is added correctly. One thing I want to note here is that Benton County does require that each employee be trained, which actually took a lot of time for staff. So when you say, what's your license fee? It took a lot of time for them to track down, okay, did their staff take it and where is it? And we can cross compare on the back end of the system. The next piece is also from Benton County. This is an attestation form from the owner saying that I agree to follow the rules. I know what the rules are and that I will do the best I can and to follow all provisions of the ordinance. And then this is also a required part of the application and renewal.
Great, thanks, Katie. I think we have a few minutes for some Q&A. So we're going to stop sharing the screen here, and I'm going to hand it over to Willow, who's been monitoring the chat.
Yeah, we got a couple questions here. I think the first question, maybe Rachel Callanan, I'll give you the legal question, and Katie Engman, the advocacy question. We have a question, can a city create an ordinance that is weaker than the county ordinance? Example, county has 1,000 feet from school or daycare and city has 250 feet from school or daycare. Is that acceptable?
Yeah, I mean, it depends. If the city is doing their own licensing, they can do their own licensing. If the county is doing the licensing for the city, then the county's requirements for proximity or distance requirements would apply. So it's a unique thing about Minnesota law where, the county is responsible. So if any cities just choose to defer to the county, they can do that. But if the city chooses to do their own licensing, they get to set the terms of their license.
Great, thank you. There's another question here about who is the regulating agent for the sale of psychoactive cannabis products?
Yeah, that's a good question. Right now, it is the Office of Cannabis Management has that responsibility. There is currently no sales except for on tribal lands. Some of the tribes are currently actively selling cannabis products, But that is, and I just want to note too, that is a very separate discussion from commercial tobacco regulation. And so, local jurisdictions may want to look at what they can do to enact their own local ordinances, but we're really strictly talking about commercial tobacco licensing here today.
Thanks, Rachel. Yeah, I was going to end on with you, Katie, but then another one just came in the chat that I think is probably a common question. In terms of proximity, what is considered a youth-oriented establishment? Also, regarding purchase, use, and possession laws, how does this differ for minors under the age of 18 or underage persons between 18 and 20? And lastly, do you recommend all retail staff go through training if required, or as mentioned, is that too time consuming to track? There's a lot there tied in there. Katie, you want to try that one?
I recommend absolutely that retailers go through training. Let's just start with that one. It is not too time consuming. If you look at what the fines can be, it's worth paying an employee to go through it. Is it too time consuming to track? I think I would actually ask Benton County that. I think sometimes it is. I think that, it is hard. But the time to track should be built into your license fee. And there should be no qualms about that. They're making billions of dollars off of the backs of people in our state, and charging them more than $100 is just fine. Okay, what are the
That's great, Katie. I think that leads into maybe our last piece. If you want to bring it home, that the first question in our chat was one of the biggest challenges in establishing a state retail licensing program is the enormous amount of funds and staff necessary to operate an effective licensing program. How can we help legislators to understand this need?
the time it takes, have them go out and do it with you. I just, if you have not ridden along and done, been in the back seat, to do it, encourage them to join you and see what's going on. There's so many great stories that come out of literally the car, when doing these inspections. This must be from a different state because we don't have a state retail licensing program in Minnesota, and all of those fines are done or those fees are done at the local level. But I encourage everyone, if you haven't done it, sit in the car, see what these kids come out with, or hear the stories. It's fascinating.
Well, thank you all so much. That was very informative. If you have more questions or if we didn't have a chance to respond, feel free to reach out to any of us here at the Public Health Law Center or Katie and her colleagues at Answer. We are here to provide that free legal technical assistance, and these are the kinds of questions we love to engage with. So thank you all very much for your time, and just know that we're here to support you with those commercial tobacco technical needs. Thank you.